Hello, I am Dr. DeAndre. Today I will talk about why cancer is increasing in young people. Over the past decade, doctors and researchers have observed a concerning trend. More individuals in their 20s, 30s, and early 40s are being diagnosed with cancers that were previously more common in older adults. This is not a minor increase. Recent global data shows a significant rise in early-onset cancers, particularly colorectal, breast, and pancreatic cancers. In some regions, colorectal cancer rates in people under 50 have increased by more than 50% over the last 2 decades. This shift raises an important medical question. Why is this happening? Cancer typically develops over many years due to genetic mutations and environmental exposures. However, the earlier onset suggests that risk factors are now affecting individuals at younger ages or with greater intensity. In this video, I will explain the scientifically supported reasons behind this trend, including lifestyle factors, environmental exposures, and biological changes. Understanding these factors is essential for prevention and early detection. Early-onset cancer refers to cancers diagnosed in individuals typically under the age of 50. These cancers are biologically similar to those seen in older adults, but they often present at a more advanced stage due to delayed detection. From a medical standpoint, cancer develops when cells accumulate genetic mutations that allow them to grow uncontrollably. These mutations can result from inherited genetic factors, environmental exposures, or random cellular errors during replication. In younger individuals, inherited genetic conditions account for a small percentage of cases. However, the majority are linked to lifestyle and environmental influences. This indicates that modifiable risk factors are playing a larger role than previously understood. Another important aspect is that younger patients are less likely to undergo routine screening. For example, screening for colorectal cancer often begins at age 45 or later. As a result, cancers in younger individuals may go undetected until symptoms become noticeable. Clinical observations show that younger patients often present with symptoms such as unexplained weight loss, persistent fatigue, changes in bowel habits, or unusual lumps. However, these symptoms are sometimes overlooked or attributed to less serious conditions. Understanding early-onset cancer is essential because early detection significantly improves treatment outcomes and survival rates. Lifestyle changes over the past few decades are considered a major contributor to the rise in cancer among young people. Diet, physical activity, and body weight all play significant roles in cancer risk. Modern diets often include high levels of processed foods, refined sugars, and unhealthy fats. These foods contribute to obesity, which is a known risk factor for at least 13 different types of cancer. Excess body fat promotes chronic inflammation and hormonal imbalances that can support cancer development. Physical inactivity is another key factor. Sedentary lifestyles reduce metabolic efficiency and contribute to weight gain and insulin resistance. Elevated insulin levels may stimulate the growth of abnormal cells. Alcohol consumption and smoking also remain important risk factors. Even moderate alcohol intake has been linked to increased risk of certain cancers, including breast and liver cancer. Patients often report long-term exposure to these habits without immediate health effects. However, cancer development is a gradual process that may take years to become apparent. Adopting healthier lifestyle habits, including regular exercise and balanced nutrition, can significantly reduce cancer risk. Environmental exposure to harmful substances is another critical factor. Air pollution, chemicals, and toxins in the environment can damage DNA and increase cancer risk. Pollutants such as fine particulate matter can enter the body through the lungs and bloodstream. These particles generate oxidative stress, which damages cells and promotes mutations. In addition, exposure to certain chemicals found in plastics, pesticides, and industrial products has been associated with cancer risk. These substances may disrupt hormonal balance and interfere with normal cellular function. Younger generations may be exposed to these environmental risks for longer periods, increasing cumulative exposure over time. Clinical data suggests that individuals living in highly polluted areas may have a higher risk of developing certain cancers. Reducing exposure by improving air quality, avoiding harmful chemicals, and using protective measures can help lower risk. Recent research has highlighted the role of gut health in cancer development. The gut microbiome consists of trillions of microorganisms that influence digestion, immunity, and inflammation. An imbalance in these microorganisms, known as dysbiosis, can lead to chronic inflammation and increased cancer risk. Diet plays a major role in shaping the microbiome. High consumption of processed foods, low fiber intake, and excessive sugar can disrupt gut balance. This may contribute to conditions that promote cancer, particularly colorectal cancer. Studies show that individuals with healthier diets rich in fiber, fruits, and vegetables tend to have more balanced microbiomes and lower inflammation levels. Patients with poor gut health often report digestive symptoms such as bloating, irregular bowel movements, and discomfort. While these symptoms are not always linked to cancer, they may indicate underlying issues. Maintaining gut health through diet and lifestyle is an important preventive strategy. One of the most significant reasons for increased cancer impact in young people is delayed detection. Screening programs are typically designed for older populations, which means younger individuals are less likely to be tested. As a result, cancers in younger patients are often diagnosed at more advanced stages. Advanced stage cancers are more difficult to treat and may require more aggressive therapies. Common symptoms such as fatigue, weight loss, or digestive changes may be overlooked. Many individuals delay seeking medical advice, assuming these symptoms are not serious. Statistics show that early detection dramatically improves survival rates. For example, early-stage colorectal cancer has a survival rate exceeding 90%, while late-stage detection significantly reduces survival. Increasing awareness and encouraging timely medical evaluation are critical steps in addressing this issue. In summary, the rise of cancer in young people is influenced by multiple factors, including lifestyle changes, environmental exposures, gut health, and delayed detection. This trend highlights the importance of prevention and early awareness. Simple steps such as maintaining a healthy diet, staying physically active, avoiding harmful substances, and paying attention to early symptoms can make a significant difference. Always consult your physician if you notice unusual or persistent symptoms. Early evaluation can lead to early diagnosis and better outcomes. If you found this information helpful, consider sharing this video and subscribing for more evidence-based health content.